Hello everyone and welcome to the first video of a four-part educational video series for stroke education. My name is Sydney Ellis and I'm a Doctor of Occupational Therapy student at the University of St. Augustine for Health Sciences in Austin, Texas. The aim of this video series was to provide individuals with stroke, caregivers, and occupational therapy practitioners with an alternative format of client education that can be used as a resource throughout recovery. In this video, we'll be discussing the basics of stroke education and its impact on our daily activities. We'll start out by defining what a stroke is. A cerebral vascular accident, or CVA, is also more commonly known as a stroke. This is a form of non-traumatic brain injury that occurs when the blood supply to the brain has been disrupted or cut off, reducing the availability of oxygen and nutrients that can get to the brain. This disruption in blood flow results in cell death or brain damage, leaving survivors with varying degrees of physical, mental, and emotional deficits that impact their ability to perform daily tasks independently. There are three common types of stroke: an ischemic stroke, a hemorrhagic stroke, and a transient ischemic attack, or a TIA. An ischemic stroke occurs when blood clots or other particles such as plaque and fatty deposits block the blood flow to the brain. These account for about 87% of all strokes. A hemorrhagic stroke occurs when an artery in the brain leaks or ruptures, leading to an increased amount of pressure on the brain. The last one is a transient ischemic attack, or a TIA. These are also oftentimes referred to as mini strokes or warning strokes. TIAs occur when the blood flow to the brain has been temporarily blocked. These types of strokes usually self-resolve and dissipate within 5 minutes, however they may last longer depending on the stroke. As the name suggests, a TIA is a warning stroke, and recognizing and treating a TIA can reduce your risk of a major stroke in the future. Stroke is considered the fifth leading cause of death and severe disability in the United States. According to the CDC, 17.5% of all cardiovascular-related deaths were due to stroke. This is 1 in 6 people. Every year, approximately 795,000 people suffer a stroke, with 610,000 of those being individuals experiencing a new or first stroke, and 185,000 of those being individuals experiencing their second or third stroke. Although I feel this number should be much higher, only 38% of individuals were able to recognize the signs of a stroke using the FAST mnemonic. FAST stands for face, arm, speech, and time. This mnemonic has since been altered to the BFAST mnemonic, which has shown to have significantly higher rates of successful recognition. Another interesting statistic I decided to include relates to the cost of stroke-related care, which accounted for nearly $254 billion of hospital spending and is expected to increase to $2 trillion by the year 2050. Risk factors and preventability of a stroke are organized into two main categories: controllable risk factors and uncontrollable risk factors. Controllable factors are those that can be changed or managed through medical intervention and/or lifestyle changes, and uncontrollable factors are those that cannot be changed and are fixed. A few of the controllable factors include high blood pressure, high cholesterol, diabetes, smoking and vaping, physical inactivity, obesity, carotid artery disease and other artery diseases, atrial fibrillation and other heart diseases, certain blood disorders like sickle cell anemia, excessive alcohol intake, drug use, and sleep apnea. Uncontrollable risk factors are things such as age and increasing age, gender, as women typically have a greater risk of stroke than men, heredity or having a family history of cardiovascular disease, and having a prior history of stroke. BFAST mnemonic is commonly used to help people remember and recognize the signs of a stroke. BFAST stands for balance, eyes, face, arm, speech, and time. When discerning whether or not you yourself or someone around you is having a stroke, it's important to take a look for the following signs: a sudden loss of balance, headache, or dizziness, blurred vision, facial drooping on one side of the face, one-sided weakness in the arm, leg, or both, slurred speech and sudden confusion, and lastly, it's important to note the time of when symptoms started and seek medical attention. Remember, time is brain, and the sooner you receive medical attention, the better your prognosis becomes. So think, be fast. I will now be discussing the specific symptoms associated with strokes affecting the right side of the brain. I want to preface that our brain is wired to control the opposite side of our body, hence why a right-sided stroke impacts the left side of the body. Every stroke is different and may impact individuals differently due to a variety of reasons, and you may have experienced different symptoms than these provided. However, the general symptoms of a right-sided stroke are left-sided weakness and paralysis, left-sided sensory loss, left-sided neglect, which is the lack of awareness of the left side of the body, impaired judgment and safety awareness, visual impairment, behavior and personality changes outside of the person's normal, such as impulsive behavior, lack of concern, and quick or overly curious behavior, difficulty recognizing and identifying objects and faces, and decreased attention span. In contrast to a right-sided stroke, a left-sided stroke impacts the right side of the body and typically has more severe symptoms associated with it. A few of the general symptoms individuals experience with a left-sided stroke are right-sided weakness or paralysis, difficulty with speech and understanding language, difficulty with swallowing, sensory loss on the right side of the body, visual impairments, difficulties with proprioception, varying levels of cognitive impairment, slow or cautious behavior, impaired ability to read, write, and learn new information, and memory or problem-solving difficulties. The Brunstrom 7 stages of stroke recovery is used as a guide for what to expect after a stroke. Like I've been saying, every stroke is different, so your timeline might look slightly different as well. Keep in mind that due to the unique nature of a stroke, your baseline, or where your recovery journey started, may not be at stage 1. The first stage is flaccidity. This is the initial stage where muscles become weak or limp due to the brain losing its connection to the affected limb. In stage 2, we start to see spasticity. This is where muscle tone increases, causing stiffness and involuntary contraction of muscles. In stage 3, the stiffness becomes more pronounced. By stage 4, we start to see stiffness decrease and some voluntary movement may return. In stage 5, this is complex movement combo, where we start to combine voluntary movement regained with functional tasks such as grasping in preparation for functional tasks. In stage 6, spasticity disappears. Stiffness decreases, allowing for more smooth, controlled movements on the affected side. In stage 7, we should see normal function return. The treatment you receive after a stroke is multidisciplinary and requires the support of various healthcare professionals in order to address your needs adequately. You may already be familiar with your primary care physician, as these are the doctors who are primarily directing your plan of care in and out of the hospital. You will continue to see them throughout your recovery, along with your neurologist, who is responsible for all things brain. However, your primary care physician and your neurologist are not the only members of the healthcare team that can provide support. The nursing staff provides support by helping you adjust to life after a stroke and assist in daily care tasks and medical needs while in a hospital or at a facility. Social workers assist clients in getting the care they need by assessing needs, situations, strengths, various avenues of support, and advocating for clients within the healthcare system. The rehabilitation team consists of a few different members that you may seek services from depending on your needs. Occupational therapists help survivors relearn motor skills needed to perform daily activities. Physical therapists focus primarily on limitations related to movement and balance. Speech-language pathologists who address problems related to speech, writing, reading, and understanding words, along with swallowing difficulties. They may also address cognitive impairments depending on the hospital, facility, or clinic. And recreational therapists. There are many other healthcare professionals you may seek support from, such as dietitians, cardiologists, neuropsychologists, physiatrists, and optometrists. If you have any questions or concerns about your care, always speak to your doctor or your social worker, as they can help get you connected to the care you need. The symptoms of a stroke can have a lasting impact on the physical and mental well-being of survivors and caregivers. The barriers many survivors face inhibit their ability to engage in daily occupations, which negatively impact motivation, confidence, and the recovery process over time. In occupational therapy, the term occupation is used to define any activities you do in your day-to-day life that you find meaningful and are goal-oriented. There are two categories of occupations. Activities of daily living, or ADLs, which are daily tasks that are essential for survival, such as performing self-care tasks, showering, dressing, eating, and functional mobility. and instrumental activities of daily living, or IADLs, which are especially important for independent living. These are activities like caring for others, social participation, driving, cleaning and housekeeping, and cooking. Therapy services such as occupational therapy and physical therapy can help survivors relearn skills they need to perform their daily activities independently. It is important to try and stay active after a stroke, as this can not only provide a sense of community, but is also shown in research that socializing with others promotes a healthier recovery process and builds motivation and confidence. Many clients want to re-engage in social events but don't know where to start. There are a few different ways to locate support groups in your area, one being to search for support groups on the National Stroke website, which allows you to search for groups in your area by zip code. Many of these support groups are held by hospitals, facilities, and clinics and usually meet once a month, offering both in-person and virtual options. You can also join one of the many Facebook or other social media platform support groups. These groups provide a sense of community by allowing others to discuss their recovery journey, progress, and ask the community questions. When in doubt, you can always ask a member of your healthcare team to provide you with resources or connect you to a local support group. I hope you found this video informative and helpful as you continue your journey through recovery. Please feel free to ask any questions or leave a comment down below. Thank you for your time, and I'll see you in the next video.